Okay. Classify DNA viruses in terms of their viral envelopes. This should be easy. There are only two classifications. It's either naked or enveloped. Either naked or enveloped. Answers? Okay. My formula is PAP HPP. PAP HPP. That's how I used to remember them. There's a reason I put it like this. So the naked ones are the PAP, then HHP is the enveloped. So the naked are parvovirus B19, adenovirus, papillomavirus, which is the HPV, and then polyomavirus, which is JC virus. And then the enveloped are hepatitis DNA, hepatitis B, and hepatitis DNA is hepatitis B, herpes viruses, so the herpes 1, 2, 3, all those, and pox viruses. Okay. So this, whatever I'm going to tell you is more relevant for MCQs. If you write it like this, the order in which I've written it is PAP HHP. I want you guys to remember it like that because number one, this parvovirus, it is the smallest virus, while pox virus is the largest virus. Okay. Parvo is the smallest, pox is the largest. So I've arranged it like that. Next, this is single-stranded. Parvovirus is the only single-stranded virus, DNA virus. The rest are double-stranded DNA. Okay. So two unique things about Parvo. It is the smallest and it is the only single-stranded DNA. The rest are double-stranded DNA. Definitely, we know hepatitis B is partially double-stranded DNA. Yeah. Another one. The three in the middle, if you were to arrange them in one line, the three in the middle are papilloma, polyoma, and hepatitis B. Those three in the middle are circular. Okay. The rest are linear. So this is linear, circular, 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 linear, linear. The three in the middle are circular. Okay. Pox, it is the largest and it is the only one that replicates in the cytoplasm. I used to say pox out of the box. The rest replicate in the nucleus. Pox is the largest, so you can picture it. It is the largest virus, so it cannot replicate in the nucleus. It replicates in the cytoplasm. And then another unique feature of pox is it is the only one with a complex structure. The rest are icosahedral. Okay. So I've told you almost 5 high-yield things. You'll use them in MCQs because they can twist it. All the following are double-stranded DNA except, all the following are linear viruses except, all the following are icosahedral except, all the following are circular except, all the following replicate in the nucleus except, all the following are double-stranded except, you see? So there's a reason I arranged it like this, PAP, HHP. Are we clear? Any question? I go to the next question. We are clear? Okay. So here's the next question. I feel like I already showed you guys. What did you say about the middle three? So the middle three are the circular ones. Papilloma, HPV, JC virus, polyoma, and hepatitis DNA, which is hepatitis B, are the circular ones. The rest are linear. Okay. Okay, good. So identify the receptors used by these viruses. So I think the ones you're more familiar with are HIV and SARS-CoV-2. I don't know if you know these others. So CMV uses integrins, EBV uses CD21, HIV, CD4, we know CD4, then the core receptors are CXCR4, CCR5. And then parvovirus B19 uses P antigens on the surface of RBCs. Rabies uses nicotinic acetylcholine receptor. Rhinoviruses uses ICAM1. Then SARS-CoV-2 uses ACE2. So also this can come in MCQs where they tell you they have matched the receptor, which one is not true, something like that. But I wanted to put it here because they can also bring such a thing. Okay. Hope we're clear on that. Yeah. From here, the questions are easier. So I think we'll finish on time. Yeah. List 5 viral causes of sexually transmitted diseases. There are actually 6. So 5, listing 5 should be easy. HPV, very good. Another one? HSV. Which one? 1 or 2? You know, there's neonatal and genital. Which one? 2, good. Here, another one. I can't believe no one is telling me HIV. That should be your first answer. Hepatitis B, good. Hepatitis B and E. There's one you guys are forgetting, and we have done it. It was our first question. I think one of the first questions we did. Zika, very good. Okay. Okay. So HIV, which causes AIDS, HPV, which causes genital warts, cervical anal cancers. Hepatitis, so HSV, genital herpes, and then hepatitis B, where you see B usually goes with C, okay? In everything, causes, they are all associated with the lung carcinoma. The only difference between hepatitis B and C is hepatitis B has a vaccine, C doesn't, because they all lead to hepatocellular carcinoma. Then we have Zika. Okay, I saw someone say E. E is not sexually transmitted. E is fecal-oral. Both hepatitis A and E are fecal-oral. Okay, so it's B and C. Okay. Yeah. Another question. Discuss the route of transmission and pathogenesis of herpes simplex 2 virus. So, remember I said you have to know how it is got. So in this case, transmission is through sexual contact and perinatal transmission. So neonatal herpes occurs when an infected mother transmits HSV2 to the to the baby during vaginal delivery. Okay. Pathogenesis. We start with the viral entry. So in this case, it is sexually transmitted. So it will infect the mucosal epithelial cells or abraded skin in the genital area. So that's why in people with herpes, the genital herpes, they will tell you they have, it's called herpes genitalis, the sores down there, okay? And then the virus enters host cells using specific receptors. It replicates in the epithelial cells, causing cell lysis and inflammation. Then remember I said after infection, we go to spread. It will definitely spread and there'll be an immune response. So infected cells release pro-inflammatory cytokines and attract immune cells. The host immune system partially controls the infection but cannot eliminate it. So one thing about herpes you have to know is they have a term called latency. Latency is where it remains hidden from your immune system. And in this case, hepatitis, sorry, why am I saying hepatitis? Herpes simplex 2 stays latent in the sacral ganglia. Okay, sacral ganglia. Where does herpes simplex 1 stay latent? Considering it is an upper respiratory tract infection. Where does it stay latent? Which ganglia? Trigeminal ganglia. Very good. So here, this one is it's a sexually transmitted infection, so it will stay latent in the sacral ganglia. So remember, as it stays latent, there are some things that will cause reactivation, such as stress, fever, hormonal changes, immunosuppression, UV exposure leads to reactivation. And once it leads to reactivation, it will travel back to the skin, causing recurrent genital herpes outbreaks. Okay, so is it clear? You start with the infection, the spread, the latency, then reactivation. Okay. Then we go to outline 5 viruses that affect each of the following systems. This one, everyone should be singing them. Respiratory system and cutaneous system. There are so many. Human influenza, rhinovirus, corona, influenza, good. Adeno. Cutaneous. Herpes. So it's HSV1, HSV2, HSV3, HPV. Pox virus, good. So we have monkeypox, smallpox, molluscum contagiosum, good. HPV, very good. You see, these ones you should be singing. So influenza, rhino. You know, rhinovirus is the one that causes the common cold. Then respiratory syncytial virus, RSV, adenovirus, SARS-CoV-2. This is corona. Okay. And then cutaneous, we have herpes. This is VZV is herpes 3, HPV, herpes simplex 1 and 2, measles, molluscum contagiosum, monkeypox, smallpox. Okay. Then outline 5 major differences between naked and enveloped viruses. So here, definitely, I just lifted from your slides. It can be asked. So there are these properties, direct from your slides, by the way. We have environmental stability. So how I remember this is enveloped viruses, they fear the environment. That's why they are enveloped. But naked, since they are naked, they have no envelope, they are strong. That's how I used to picture them, okay? Enveloped, since they have the envelope, they fear. You know, if someone lives inside a house, they fear maybe burglars, they fear cold weather, they fear. But if you're naked, you live outside the house, you don't fear anything. You're strong, okay? So with that principle, environmental stability, enveloped are labile. They can be destroyed by acids, detergents, drying, disinfectants. That's why they have the enveloped. Naked, they are strong. They don't need that. So they're stable to temperature, acids, and proteases. Released from cells, they are released by budding and cell lysis. These ones are released by cell lysis. Spread to hosts. So these ones, they are spread via large droplets, secretion, transplanted organs, or blood transfusion. Okay, because they cannot survive outside of the body. Okay, these ones, because they can survive outside the body, direct contact is okay. Dust and small air droplets. These ones, they need, you see, like they need secretions. They don't want to stay outside of the body for a long time. So if it's vaginal secretions or if it's blood transfusion, it's going direct. Okay, enveloped must stay wet to remain infectious. You see, that's why they require these fluids. Naked can dry out and still retain infectivity. You see, they can be spread via direct contact, dust, or they can stay on the surface of let's say on the table or something like that. These ones, very useless. They cannot survive the GIT. These ones can survive. Okay. Effective immune response requires both antibody and cell-mediated immunity for protection. This one, antibodies alone may be sufficient for protection. Okay, so if you just have that same principle, understanding this can be easy. So once you understand, you can cram. Okay. Next. Now I want you guys to answer this as a block. Number 1, classify giving examples of the viruses in the family picoRNA viridae or Picona viridae. And then outline the diagnosis of rabies. List 5 oral manifestations of HIV. Mention 5 viruses that are transmitted via mosquito vector. List down the clinical manifestations of yellow fever virus. Okay. You can answer any. You can start with the first one. Answers in the chat. So one thing to mention, I chose rabies for no apparent reason. When you see this question, they can ask any virus. Outline the diagnosis of dash virus. You remember when we were doing the question on short notes? So here they're asking about diagnosis. So one thing about diagnosis, what I want you guys to, how to answer it is, number 1, you start with, you do a proper history and physical examination, regardless of the virus. Okay? You start by doing a physical examination and you take a proper history. And then number 2, you have to know how is the virus spread. So in this case, if you know it is spread via the RESP system, if it's spread via the GIT system, if it's spread via the musculocutaneous, if it's spread via the, if it's an STI, sexually transmitted disease, you know how you're going, which specimen you're going to collect. Okay? Then once you collect this specimen, is now when you go to the diagnosis, the lab diagnosis. So here we're interested in serology, where we talk about the antigens and the antibodies, or we do PCR. PCR, I told you, is to detect the genetic material, either RNA or DNA. Okay? So that is how I want you to answer questions in regards to diagnosis. You start with do an exam. You take a proper history from the patient. So in this case, the patient will tell you, oh, I was bit by a dog. Then I'll ask, oh, how was that dog? Was it foaming? Was it doing this, this, and this? What are you doing? And then you do a proper physical exam. So in this case, for a rabies patient, you look at the wound, you check if there was penetration of the skin, you clean the wound, you do things like that. Okay? Are we clear? I hope that's clear. Yeah. 41, list 5 oral manifestations of HIV. Lifted from your notes. It can be anything. Oral manifestation, cutaneous manifestations. Okay? I chose oral for no apparent reason, but okay, let's list them. So in this case, they're asking what oral diseases can you get if you have HIV? Because HIV is an immunocompromised disease. So which diseases come after you get HIV? Answers in the chat. Okay, I'm happy. So picoRNA or picoRNA, we had enterovirus, which is poliovirus, human Coxsackie virus, human echovirus, rhinovirus, hepatovirus, which is hepatitis B. Okay. And then outline the diagnosis. As I had said, proper history, physical exam, collect the specimen. So in this case, we need saliva, brain tissue. Unfortunately, brain tissue is only collected during postmortem. So yeah, skin, urine, CSF. Okay. So I attached some reason here why we do that. So for saliva, for PCR, or the virus isolation, skin biopsy we take from the neck of the nape, detects rabies antigen in hair follicles. CSF, the rabies antibodies. Then blood is basically for antibodies. Then tissue for postmortem to confirm something we called Negri bodies, usually found during histology. Then the tests to be done, as I said, serology, antibody and antigen, PCR to detect the genetic material, in this case, which is RNA. So here are the reasons you can check. So as I said, this Negri body is very high yield for rabies. They are intracytoplasmic inclusions, usually found within the brain. Okay. And then the manifestations, I think everyone had mentioned these, except aphthous ulcers and xerostomia. Xerostomia means a dry mouth. So xerostomia, you're going to have a very dry mouth. Okay. And then the viruses transmitted via mosquito. Yes. Is there a question?
Yeah, I was asking about herp angina.
Herp angina, the one for Coxsackie.
Yeah, can it be in HIV, the oral manifestation?
Definitely. A person who has HIV is someone who is immunocompromised. So getting it can be quite easy. But I want you to start with the cancers of the mouth. You see, like Kaposi sarcoma, and you see for herpes labialis, he had herpes, then it was latent, then got HIV, then it became reactivated. Candidiasis, you have candida in the mouth, which is, in quotes, a normal flora. But now, since you're immunocompromised, it overgrows. That's why you have the candidiasis or the oral thrush. Okay. Hairy leukoplakia, this is after you get an EBV infection. So before you mention herp angina, you start with these ones. Okay. Is it clear? I hope you're clear. Viruses transmitted via mosquito, Japanese encephalitis, dengue, yellow fever. I don't know, I forgot to add Zika. Zika, Rift Valley fever, St. Louis encephalitis, Eastern equine, EEE, and Western equine, and VEE, Venezuelan equine encephalitis. Okay, so these are good. Then manifestations of yellow fever. So usually in the acute phase, remember the non-specific symptoms: fever, muscle pain, headache, shivers or chills, loss of appetite, nausea, and vomiting. And then the toxic phase, where normally, people get yellow fever. It is very few patients go till the toxic phase, because at the toxic phase is now where there is the bleeding. Okay. They usually say around 15% of patients become symptomatic to this stage. So hemorrhage, you bleed from all the orifices in the body. Epistaxis, these are nosebleeds. Mucosal bleeding, so mouth, gum bleeding. Melena, this is the dark stool. Hematemesis, this is vomiting blood. Hematuria is blood in urine. Then we have abdominal pain and jaundice. Now, the jaundice is usually very, very severe. You can add their organ failure. Basically, the liver will fail, the kidney will fail, then leading to death. Okay. Clear? Okay. Someone is saying they hope the questions will be like this. The list 5, mention 5. Definitely. If there are 12 questions, at least 5 will look like that. Then maybe explaining, you'll have like 3 or 4. But you'll have like maybe 5 questions saying list, so that at least you can get marks. We can do these 3. Describe in detail the structural components of influenza virus, explaining how these structural features contribute to the virus's infectivity and ability to evade the immune system. Okay, let's do this first. Number 44. As I've said, it can be any virus. They can ask any virus. You describe the structural components. I chose influenza for no reason, but we can go through this. So here, you are required to know what makes up the virus. Okay, the structure. Have a picture of influenza in your mind. Definitely, if you are to start from inside outside, definitely you know that, is influenza DNA or RNA? Okay, it's definitely RNA, because in that mnemonic, PAP, HHP, we didn't mention influenza. So it's definitely RNA. Okay. So we have the genome, which is the RNA itself. We have what is outside. So if it has RNA polymerase, its enzymes. then its outer wall, basically the envelope, and influenza has very two specific glycoproteins, okay, that you must know. It's not even good to know, must know, because it can come in both SAQs and MCQs, and also spot. Okay. Aya, let me see what you guys are saying. Okay. Aya. So influenza is an enveloped negative sense single-stranded RNA belonging to the family Orthomyxoviridae. The virus is surrounded by a lipid bilayer envelope derived from the host cell membrane during viral budding. Okay, I had a picture here. So look at this picture. As you can see here, from the outside, we have, okay, let's start from the inside. We have the segmented negative stranded RNA gene, here it is. Then we have the nucleocapsid protein, here it is. Then we have the matrix protein, so M1 matrix. And then we have the M2 protein. So the M2 protein is an ion channel. Okay. Then we have hemagglutinin. These are the glycoproteins, hemagglutinin and neuraminidase. Okay. And then we have the RNA polymerase PB1, PB2, PA. Okay. And then we have the lipid bilayer. Here it is. Okay. So that is the structure of influenza. NEP, this is the nucleoprotein. Okay. So now this is the structure. And the question has asked us how it is used for, where is it? Contribute to the virus's infectivity and ability to evade the immune system. We start. The glycoprotein. Hello? Were you hearing me? Okay, thank you. I thought I was talking to myself. Okay. As I was saying, the hemagglutinin, it binds to sialic acid receptors on the host cell, enabling viral entry. Okay. Then neuraminidase cleaves sialic acid to release newly formed viruses, facilitating spread. So as someone had said, hemagglutinin entry, neuraminidase spread. Okay. And then we have the matrix proteins. As you had seen, M1, the function is just to give the virus its shape and to be stable. M2, it is the channel, this one. See this one? It's an ion channel. Functions as a protein channel, helping in viral uncoating and release of genome into the host cell. Then we have the segmented RNA, usually 8. I want you guys to tell me, what are the other segmented viruses? The mnemonic is usually Bora. Bora. I think I had told you guys before, last time. Bunya virus, yes. Adenovirus, yes. Riovirus, which is Rota, yes. And influenza, which is Orthomyxovirus. So Bora, then A is adeno. Good. Haya. So we go to, where are we? The segment. So each segment codes for essential viral proteins, including the polymerase. So as we had seen here, this one's PB1, PB2, and PA, needed for RNA replication. The segmented nature allows genetic resortment, leading to antigenic shifts that contribute to viral strains. Okay. So basically, this means the mixing of segments of two different viruses. I remember we had done the story on antigenic shift and drift, but we can, I think I'll put it here. Let me check for you. Just to mention, because I want us to remember. Shift. Okay, because it can come as an essay where you're told, explain the differences between antigenic shift and drift in viral evolution. So where's that picture? I had done this, but basically to summarize is when you hear the word shift, think of a new virus, a new strain. Can you see? So A and B give you C. Drift, accumulation of mutations over time. Okay, and it is actually very gradual. Okay, so here you can see virus A mixes with virus B, giving you virus C. But drift, accumulation of mutation over time. Okay, but I had done that, and here are the differences. Okay, and then we go to nucleoprotein and RNA polymerase complex. So this one and this complex. Viral RNA is coated for nucleoprotein, which helps in genome stability and replication. Then RNA-dependent RNA polymerase, basically for RNA transcription and replication. So here, the virus, so host immune evasion from those two mechanisms through antigenic drift and antigenic shift. So the virus constantly changes its surface glycoproteins, the hemagglutinin and the neuraminidase through antigenic shift and antigenic drift, allowing to evade host immunity. Are we clear? Okay. So, as I said, it can be any viral structure and how to evade the immune system. It can be COVID. So you mentioned the spike protein. It can be HIV. It can be hepatitis B. Okay, any. Higher. The next one. Identify and list the groups of individuals. So this one I lifted from your notes. For whom the WHO recommends annual influenza vaccination. There are actually 5. So here you cannot guess. I mean, yeah, you can try guessing, but there are actually 5 because it is the WHO who recommend it. Yes, answers in the chat. So this is the WHO one, very specific. Pregnant women at any stage of the pregnancy, children aged 6 to 5 years, elderly greater than 65, individuals with chronic medical conditions, asthmatics. Remember, influenza is a respiratory disease, diabetics, people with heart diseases, so people like with heart failure, immunosuppression. So these are people who have like HIV, people who are on immunosuppressant drugs. For example, if you've had like a kidney transplant or an organ donation, an organ transplant, and you're using immunosuppressants. Then healthcare workers, due to the high exposure risk. And we don't want to transmit to the vulnerable patients because we interact with these patients who are immunosuppressed. So there's no need for them to get influenza. Okay. And then for the adenovirus, remember I said it affects multiple systems. So throat swabs, nasopharyngeal aspirates, conjunctival swabs because it causes conjunctivitis, urine, stool, blood. As I said, and I repeat, blood should be your first answer. Okay. So stool is because it causes gastroenteritis. These throat swabs, nasopharyngeal aspirates because it causes pneumonia. And the pharyngitis, okay? Basically sore throat. Then why urine? I want you guys to tell me, why do we collect urine? What does it cause in children? What does adenovirus cause in children that makes us collect the urine? Very specific for children. Yes, it causes hematuria. Yes. But what is the pathology called? What is that disease called? Cystitis. Very good. So it's called acute hemorrhagic cystitis, which presents with hematuria. Okay. But very specific. They usually no fever. Okay. So you can imagine someone is peeing blood. And it's usually painful, but they don't have a fever. Okay. So that's how you know that is acute hemorrhagic cystitis. Yeah, I think we're done. So we can tackle all these 4 questions first. Outline the common post-COVID symptoms, categorizing them based on affected body systems. Okay. Number 48, provide an outline of examples of viruses that can be isolated using cell culture. 49, differentiate between furious and paralytic rabies. Then 50, discuss in detail 5 factors that fuel the emergence and reemergence of viral infections. Okay. Answers. So we can start with 47. There are a lot. If you've been asked to categorize based on systems, just know it affects multiple systems. So even if you have no clue at all, just put RESP, CVS, GIT, urinary, reproductive. Even if you have no clue at all, just write. And then you write the common symptoms in those systems. Trust me, you will get something. And then one thing is there are these systems, these symptoms that are very non-specific. You remember the ones that we said? Fever, fatigue. Those ones, we classify them under general. So mention those. Okay. Yeah. Answers in the chat. Yeah. So post-COVID syndrome, or the long COVID, refers to persistent symptoms that last to months, weeks to months after the acute phase of COVID-19. And it affects very many organs. So I have a diagram here. This is from your notes. So we start from CNS. So we have mental health. This is anxiety, depression, sleep, substance abuse. Then CNS itself is stroke, headaches, memory problems, smell problems. Cardiovascular, we have acute coronary syndrome, heart failure, palpitations, arrhythmia, hypertension. So instead of saying acute coronary syndrome, you can just say maybe chest pain, heart failure, you can say difficulty in breathing, all those things. And then we have RESP, cough, shortness of breath, low blood oxygen. Metabolic or endocrine, so this is the pancreas. We have obesity, diabetes, high cholesterol. GIT, we have constipation, diarrhea, acid reflux. Kidney, acute kidney injury, chronic kidney disease. Okay, so you can say flank pain because the kidneys are found in the flanks. So you can have flank pain, you can have difficulty urinating, or, or low urine output. Okay, because acute kidney injury and chronic kidney diseases is a complication or is a disease in itself. But if you ask symptoms, just mention flank pain. You can mention, low urine output. Okay. And then musculoskeletal, joint pain, muscle weakness. GIT, constipation, diarrhea, acid reflux, skin, hair loss, rashes, coagulation disorder. So this is hematological, blood clots. Then general, we have malaise, fatigue, anemia. So as you can see, so here is the theory. That was the diagram. Here is the theory. I'd written it down. So as I send the notes, you're going to go through them. But hope you guys can see. So you can see proteinuria, hematuria, frequent urination, incontinence. Okay. You can also add oliguria, which means low urine output. Okay. Okay, I hope that's clear. And then provide an outline of examples of viruses that can be isolated using cell culture. Lifted from your notes, we have herpes, CMV, adenovirus, polio, Coxsackie, echo, influenza, parainfluenza, mumps, and RSV, which is respiratory syncytial virus. I mean, there are very many techniques for cell culture, but I don't think they can ask you that. Okay. Maybe just knowing the viruses that can be got through cell culture. And then differentiate between furious and paralytic rabies. Maybe to mention, the rabies that you guys know is the furious one, where you're having hydrophobia. Hydrophobia is the fear of water. So what happens is these people, they fear water. And once you put, when you show them water, they will start, their pharyngeal muscles and laryngeal muscles, the muscles of the throat will start spasming. And once they spasm, saliva production increases. That's why you're going to see the forming at the mouth. Okay? Due to that. Then they're agitated, they're aggressive, they usually have hallucinations, muscle spasm, hyperactivity, confusion, and autonomic dysfunction. They also, aerophobia is the fear of air. They also fear that. They fear the water and air. For paralytic, from the word paralytic, the marked symptom is paralysis, and it's usually flaccid paralysis. Okay? Muscle tone. So muscle tone is from the word muscle tone. It's just the tone at your muscles. These ones, they're going to have spasm, so it's going to be increased, and they're going to have hyperreflexia. So basically, they're reflexes. Reflexes is like, for example, the knee jerk reflex. When I hit you at your patella tendon, your knee is supposed to jerk. So when you do that, it's going to jerk. It's going to jerk in an exaggerated fashion. So that's what we call a hyperreflexia. But these people, they're having paralysis. So definitely the muscle tone will be decreased. Then the cause of death here is usually due to the autonomic dysfunction. So we usually get cardiac arrest. Okay, so you can imagine your autonomic nervous system shuts down and is used, the function of the autonomic system. And then for paralytic, paralysis of the respiratory muscles. So we know that the diaphragm is innervated by the phrenic nerve. So once it gets paralyzed, mean you'll be unable to breathe. Then disease duration, this one is usually shorter, 2 to 7 days, and then this one is usually longer. Then brain pathology, severe inflammation of the limbic system. This one is used to control emotions. And then this one is more extensive of the spinal cord. Okay. The last one. Discuss in detail 5 factors that fuel the emergence and reemergence of viral infections. Similar to this is from your notes. Maybe something to mention is the emergence and reemergence of viral infections. This can be so many. So if I was to go through them, economic activities like logging, irrigation, animal husbandry, things like Ebola, Zika. Once you're having deforestation, you see these animals that cause Ebola, they will now spill over to the human beings. So we are coming into closer with these monkeys and all those. Then irrigation, as you can see, you're increasing breeding grounds for mosquitoes. So things like Zika, dengue, they will re-emerge, okay? Climate change, definitely. If there is floods, what will happen? Breeding for mosquitoes, okay? International trade, travel and trade. I mean, this is almost self-explanatory. Things like COVID-19, it started from Wuhan, China. How did it reach Kenya? Because someone from Wuhan went to somewhere else, somewhere, until you came back to Kenya. And that's how it spread, okay? Immunosuppression, same to this. I mean, someone who has HIV and AIDS, you get these opportunistic diseases. they were going to reemerge. Pathogen evolution, basically this means mutation, and they mutate, and once they mutate, these drugs that we use to kill them become resistant, okay? And then we have weak public health system. So you can imagine if these diseases are reemerging and we don't even, you know, poor surveillance, lack of vaccination programs, okay? So that's why it's up to you and everyone else in the community to come in a One Health approach to know that, okay, once these, we don't want these diseases to reemerge. I think the other day there was like a monkeypox outbreak. I don't know if you heard that in the news. For a while, there was even a patient, I think 1 or 2 patients who came to KNH due to that monkeypox. So if we don't approach it in a One Health approach where we integrate both pharmacies, nurses, doctors, dentists, everyone, even community health promoters, community workers, public health officials, we won't be able to control these diseases, okay? Then poverty, I mean, and social inequality. It's true. You can imagine poverty, you live in a maybe 1-bedroom house, maybe 10 people. So you can see diseases that are spread via respiratory system, they can easily be transmitted, okay? And definitely the poor people have lack of access to healthcare. Then civil war, definitely. It's going to disrupt healthcare services, vaccination programs, and these diseases will reemerge. Same to refugee movements. You can imagine if someone comes in a refugee camp and there's poor sanitation, you see, you're going to increase the risk of these viruses that are spread via the GIT, the gastrointestinal tract. Bioterrorism, smallpox, it was eradicated in 1977, but it still exists in some labs. So you can imagine if the scientists there decide to release it, let's say, hypothetically speaking, country A releases it to country B, okay? Same to anthrax. It is a bioweapon. And then, yeah, advances in biotechnology could lead to creation of more virulent or resistant viral strains. I was seeing, they were saying that COVID-19 was created in a lab in Wuhan, China. So I don't know how true that story is, but you see, it caused a whole pandemic, not even epidemic, pandemic, okay? Illiteracy, stroke lack of awareness. I mean, illiteracy is one of the roots of almost all issues in this world. So if there's misinformation or lack of knowledge about a certain disease, people who are anti-vaxxers, they'll be like, no, I don't want to get a vaccine. Then if they get sick, what happens? Okay, and we have these myths and misconceptions. Human behavior, this means, for example, recreational activities like drug use, sexual habits. You spread these viruses and potential bacteria and all those microorganisms. So that marks the end of this revision series. I hope it was a wonderful one. Any questions? If not, I am done.